switch people on mute. Please share your thoughts, interact and ask questions. This makes it a positive experience for everyone. Remember that there's no such thing as a stupid question. And I always find that when someone asks a question, someone else is always thinking, oh, I should have asked that myself. Please use the chat function. I have it open, or raise your virtual hand for anything that you want to ask. If you do get disconnected, just rejoin. And if the slides stick, please let me know because I won't know. All I can see is what I've got in front of me. Any questions before we start? Oh, okay. So this is the agenda for today. As you can see, there's quite a bit to go through, and there is a lot more to Proxy Access than you may realise. We'll go through each section in detail, but if at any point you have a question, please feel free to ask or pop something in the chat. I might not be able to answer your question straight away that's in the chat because I'll be going through the training, but whatever you put in there, I will answer. I will be asking you some questions throughout using polls. Fingers crossed the polls work. I have been testing it with some of my staff and it has gone okay so far. So please bear with me when we get to the polls bit. And then just asking you just to join in as much as possible so you get as much out of it as you can. So what is proxy? This is a process in general practice that allows a trusted person, such as a family member or carer, to manage another person's GP online service account and speak to GP practice on the patient's behalf with their permission. Once a practice grants the access, the proxy is given their own individual login credentials, and they can use this to book appointments, order prescriptions, and view records on the patient's behalf. Patients will or still can have their own login themselves, but they would also like someone to help manage their healthcare. And who would you normally see requesting proxy? You probably mainly see family, close friends. They are the most commonest proxy when the patient wants help managing the healthcare, or if they're planning for future loss of capacity. The proxy may live a distance away and they can use their access to keep up to date with the patient's healthcare so that they know that when their help is needed. Patients who are losing capacity may not always remember consultations, test results, management plans or medication changes, and we all have them patients that we deal with every day. So how can the proxy access this information? The NHS is the best way. Now, there's a lot of different apps on the market at the moment. I think the MIGPM app was one of them, but NHS are really pushing the app for the online services for the patient and the proxies because it has everything in one place. It even has all the hospital appointments on there and the referrals. And within the 10-year plan, this will eventually include the Red Book, dental information, and they will be able to even book a hospital appointment and a lot more. From 2026, we'll start seeing this being rolled out and there'll be a lot more on there. Make a point that it is really important for your staff within your practice to know how the NHS app works, what functions it has, as it will help the patients and their proxy when asking for help. I've done a project at my practice recently where we've all sat down and opened the NHS app just to make sure my staff know how to use it, because if they're getting the questions from the patients or the proxy, it just makes your life a lot easier if you can answer their questions. So before we move on, I'm going to ask a few questions about how your practice deals with Proxy Access. Please be honest. There's no right or wrong answer. So I'm just going to open the polls and hopefully this will work. There you go. Do you just answer if you have a robust proxy access sign up in your in place at your practice? That'd be great. Okay. It's great. So quite varied on there. Oh, a few more coming in. So at the moment, we've got 62% saying yes, you have, 19% no, and 19% are unsure. Great. So as you can see, they're the results. So thank you for that. So if you've answered yes, please feel free to share your process. Doesn't have to be chapter and verse. And if no, how do you handle proxy access requests at the moment? So I'll get this up, won't be a second. There's 2 pages on there. So if you said yes, page 1. If you said no, page 2. I'll give you a few minutes to share some information. Remember that no one's here to judge what you're doing at the moment. So in the yeses at the moment, I've got GP form, access form, specially trained, which is great. Some really good things on here, photo ID, documents, you have a protocol. Interview with patients. In the no, I've got phone, and then process form, form for children. It's great. Okay. Close that and can share the results with you on here. So you can see, got lots of different things going on in practices. And we'll go into a lot more detail during the training about what the processes are and what's needed. And we've got someone there. Okay, thank you for that. So we're going to look at informal proxy access first and what this is. So firstly, informal proxy access and why this should be avoided. A patient may decide to share their practice login credentials with a trusted third party. This is sometimes called informal proxy access. This may present problems to the patient and the practice. So, for the practice, there's no audit trail of access by the proxy or anyone else that may be accessing the patient's medication or medical information and the proxy will automatically have the same access to the records as the patient, which may not be appropriate. They may see information that the patient did not wish them to see or have knowledge of. And I've seen this time and again in practices where the husbands, the wives, they just have access to the records and it's not appropriate. So we should be discouraging patients from sharing their online credentials with anyone else. It is far safer for the proxy to have their own login credential account through the link profiles. Always remember that the practice can close the patient online access at any point, especially if you believe someone other than the patient is accessing this. And again, it goes back to, should the patient be sharing it? Why are they sharing it? Do they know why they're sharing it? Do they know what they have access to? So if you do become aware that a patient is considering sharing their online account, you should make sure that they understand the risk in doing so. Excuse me. If the practice has any suspicions whatsoever that the patient is being coerced into sharing their access unwillingly, or that this person may misuse their access, you should consider switching off the patient's GP services until the circumstances can be clarified. This is really important. The withdrawal shared access, the practice will have to cancel the patient's account and provide them with a new set of login details, but only if the practice feels it is safe to do so. If you do feel that's going to be shared again, then the risk must be reiterated to the patient and their proxy. If the patient is adamant on sharing their login, then it is advisable that an enhanced review of the medical records takes place to remove any potential harmful information that the proxy may have access to. Always remember, it is better for the patient that their proxy has their own formal login credentials and a level of access customised to meet the patient wishes. So we're going to move on to children and young people, but before I do, does anyone have any comments or questions before I do? Please feel free to raise your hand or pop something in the chat. Oh, okay. I was going to bring up a poll to ask you, what age should the proxy access to the medical records be switched off automatically? Oh, you're ahead of me there. I was going to do a poll. Second. There you go. You don't have to be sorry, Rachel. It's fine. Give it a few more seconds. People are still voting. Great. So the majority have said 11. So at 62%, we've got 90% 13, 5% at 14, and 14% at 16 of age 16 years. So believe it or not, it's 11, which when you first find out this, you're a little bit taken back because you think 11 is really young. But this is actually the first milestone. So the parents of the child will usually control the access before then. And then access to the records should be switched off automatically when the child reaches the age of 11. However, we all know our systems are not equipped to do this automatically. In a wonderful world, it would, But unfortunately, we have to run searches in our EMIS systems. And then once it's gone through, it has to be done manually. So why do we switch it off? So switching it off, it basically informing the patient that there could be something going on without informing the patient. So if we don't inform, start again, make it a bit more clear, sorry. So if we don't inform the parents and we just switch it off, then the parents might be alerted to the possibility that their child has been to the practice about something that they may want to remain private. So main things that I see at my practice is family planning or mental health. Also, if the proxy isn't switched off and the child knows the parents have got proxy, then it might stop them coming to the practice to seek help. So the best thing to do is do your searches every month, look who's either turned 11 or is going to be turning 11, and then contact the parents to inform them that this is going to happen. It just makes your life a lot easier. So parents and guardians can continue to have proxy, but it's after careful discussion with whoever is in charge of that at your practice. It could be your practice manager or a GP, or if it's felt to be in the best, in the child's best interest. A practice may want to contact parents or guardians who have proxy access to a child, as I said, who is approaching the 11th birthday, and just remind them about what they need to do. Best thing we do a search. We then invite the parents and the child in and have that conversation with them before it's actually withdrawn. It just stops lots of problems going forward, but every practice is different how they deal with it. This will be just going in the chat. Second. So you have 3 different application forms, right? Okay. We'll get on to that, Rachel, later on. So between the 11th and the 16th birthdays, the decisions made at the first milestones, that's at 11, it can be reconsidered at any point between the 11th and 16th birthday. So if you consider at 11 or 12, whatever age it is that the parents can have access, you can change that later on. It's not set in stone. Each case must be considered individually with the interest of the child being paramount. For example, for parents with a GP online service access on behalf of the child and young person, say with a long-term condition that requires regular monitoring and medication, it probably would be appropriate for you to continue access after the 11th birthday. But this must balance against the challenges that may arise as a young person becomes competent to make their own decisions about the healthcare. And we've had one recently where parents have had access all the way up to the age of 14, child's turned 14, and the GPs deem them to be competent to make their own decisions. And at that point, the access has been switched off for the parent because it's what the child wanted as well. So you've got to take everything into consideration. The main thing is that when the young person decides that they are competent to make their own healthcare decisions and they want their own access, it is at this point that the parental rights are surrendered. But you've got to weigh that out with, are they actually competent to make that decision? They might think they are, but we might not think they are. They have to have a sufficient understanding and maturity to be able to make that decision. And the decision about capacity of the young persons can, however, be very complex. We all have patients that have learning difficulties that are not very well documented. I know that I have in my practice patients that have got learning difficulties and it only comes to light when the parents tell us, and it's just never been documented. And it also may be difficult to identify coercion of a young person. And it's basically letting the parents say that they want access when really the child doesn't want them to, because it could be something that they want to come to the practice for that they don't want the parents to know about. So where the proxy access has been given to the representative or representatives of a young person, because it doesn't have to just be one person, it could be mum, dad, or whoever they want. And between their 11th and 15th, the patient's capacity to make an independent decision about whether proxy access should be continued has to be assessed on a regular basis. Going back to what I said before, it's all right doing your searches when they're turning 11, but then you should have a list of all your 11 to 15-year-olds that have proxy access in place, and just constantly revisit it and make sure that you think, should the parents still have access? Once the patients turn 16, the previous competence assessment is no longer applicable, and they're assumed to have capacity unless there is an indication on the contrary. Again, at 16, if the patient wants someone to be proxy, you'd have to go through the process again. Remember, the age at which a young person becomes competent to make autonomous decisions about their healthcare, including who should have access to their GP online service, will vary from person to person. It's a very grey area for the practice to navigate through and can throw up lots of challenges. My practice started really focusing on proxy access probably about 3 years ago. And when we started this, it was very challenging. And I'm not going to say it's easy. If you're not already doing it, it gets easier. So I've just been on holiday, I've come back from annual leave, and I've got one to deal with. At first, you probably have quite a few, but as you get used to it, you won't have as many to deal with. So anyone with capacity can make an informed decision about proxy access and may give consent for the practice to give their representatives their own personal login credentials to access the patient's practice online services account. If the patient lacks capacity to give informed consent, proxy access may still be given to a family member or carer, but they must have power of attorney for health and welfare, or be a court-appointed deputy, or if a GP judges it to be in the patient's best interest. If a patient made an advanced decision about future proxy access, which was recorded in anticipation of future loss of capacity, then any decision made must be followed. For example, a patient would have capacity and they planned for a son never to have access to the medical records, or for certain parts of the records not to be shared. Proxy access may form part of normal advanced planning for dementia or end of life care, something the GP should be mindful. And no, this is not always done, but I think going forward, I think GPs need to be part of the proxy access and advanced planning. Capacity and access and the mental capacity. You always got to remember that mental capacity can fluctuate. A patient might not be able to understand the issues and make a decision on one day, but may be able to do so under different circumstances on a different day. In this context, lack of capacity implies permanent lack of capacity. If there is uncertainty about patients' capacity to consent, the practice must satisfy themselves that the patient is capable of giving consent. We all know about mental capacity assessments, and this is where you would probably get the GP to step in if you're not sure if there is a lack of capacity or not. So it's really important to have that discussion with your GPs. When the patient lacks capacity and is unable to consent, there is a need to carefully weigh the balance of benefits to the patient against the risk to make a decision that is believed to be in the best interest of the patient. And I will say this a lot, the best interest of the patient. It's not the proxy, it's the patient. It may require careful discussions with the family or persons named on the power of attorney or court-appointed deputy. When someone is applying for proxy access based on the enduring power of attorney, a lasting power of attorney or court-appointed deputy, their status should be verified by making an online check of the registers held by the Office of Public Guardian. And we know this is a free service. You'll need a copy of the LPA or any other documents mentioned, and you must make sure that the OPG, which is the Office of Public Guardian stamp, is present on the document. The LPA that you get, or any of the other documents that I've mentioned, they need to be scanned and saved into the records, and it needs to be appropriately recorded in the notes, in the EMIS records, with all the names of the appointed persons and coded that have a proxy access or LPA in place, and you can easily find it. Always remember that the health and welfare LPA is the only one that we can accept in primary care. I've had it here where we've had the financial one being brought in and saying, no, we've got power of attorney, but if it's financial, it does not stand. It has to be the health and welfare. There's also a misconception as well with the LPAs that health and welfare only kicks in once the patient has lost capacity. You will get patients that will have an LPA in place in case of loss of capacity. It doesn't stand. I've had patients kicking off with me before today saying that, no, we have it in place, but the patient has capacity. There is a misconception because the financial LPA can be used as soon as it's registered. So be really careful about what your staff know, what you know about your LPAs, because you might have LPAs on patient records and you're giving information to the people named on the LPA, but the patient has capacity. So again, it might be doing a little bit of a search within your system to see who's coded as having an LPA in place, and then having a look through them patients to see, do they actually have capacity or not? If they're deemed to have capacity, then you'll need to go through the proxy access MSOP. So you should have an SOP in place in your practice. So just be really careful with your LPAs. Before I move on, has anyone got any questions on this section? Because I know it can get a little bit mind-boggling. No? Okay. So as I mentioned before, the proxy access should only be granted to the named individuals. So if that's on the LPA and the patient lacks capacity, it's the named people. Always remember, before switching on the proxy access, the practice has to carry out an enhanced review of the medical records and redact any data that they suspect the patient may want to remain confidential. Only grant access to what the patient has asked for. So going back to the options, prescriptions, medical records, appointment bookings, and discussing problems on their behalf. If the patient is granted access to all the records and you deem this to be a problem, you are within your right to withhold access or to certain aspects of the records. I have dealt with so many people over the years that have just automatically ticked everything, even though my staff have explained to them, they read the information and they've ticked it. And then you kind of think, I know the patient and I know the son, the daughter, whoever they've given proxy to, would they want them to know information that's in the records? I then had a conversation with that patient, explained it in more detail and said they can see everything and it's kind of panic sets in. So it's making sure from the off that they do know what proxy access is. And if they have ticked everything, that they will see everything as well. Any questions? I feel like you're all very quiet and I'm doing a lot of talking. No? Okay. Rachel?
Hiya. So it's in regards to, I've forgotten the question. I was so thinking about unmuting myself that I've forgotten the question.
It's okay.
What was I going to ask? I'll come back to you.
No problem. Paula?
Hi there. I just wondered who can determine capacity. Does it have to be an appointment with the GP or can it be with the reception staff?
It depends on what you want in your practice, and it is a very grey area. So within my practice, it's usually me. So anything to do with proxy all comes through myself. And I know there's a lot of practice managers on this call go, oh my God, even more work to do. But it's not as bad as you think. You don't get that many. But we've also had practices that have the patient booked in with a GP and the GP then decides. So it just depends. I mean, if you have someone in your reception team that you think could do it, that's entirely up to you. But because of the nature and the seriousness of what you're going to be giving out, I would say it has to be someone senior within the practice.
Okay, thank you.
Is that okay?
My other question would be parents that have split up. And yeah, you knew this was coming, didn't you?
Yeah.
Children will living with mum and then dad wants proxy access and they're under 11.
Yeah.
How?
So because they are their biological parent,
Yeah,
in the court of law, they can have access to it.
right. Okay.
And you do, I get where you're coming from, Paula. We've had this a lot where mum and dad have split up. There might even been a court order in place. But as far as you're concerned, the parents to that child, so under the age of 11, both parents can have access to the records. It might be that mum or dad doesn't want the other one to have it, but that's just the way it lies.
Okay, thank you.
Have you remembered your question, Rachel?
I did, but I can't remember the exact details. It was to do with an LPA, which I'm just actually messaging the partners about because I've had a few instances where there's been an LPA on record, but then when I've actually looked at it, it's not the final document. It's just the one saying we've received it and we've got 2 weeks to ask questions about it. So anyway, I went to check one the other day, but it was asking me for like a unique PIN number.
Yeah.
But it wasn't like a reference number. It was saying a PIN, which I surmise I've got to get off the family.
Yes, you do.
Right, okay.
Yeah. So when you go into the LPO website, it will ask you for your unique PIN and you do have to get that off the family.
Okay. I just wanted to add on to what sorry, I was half typing an email at the same time. I don't remember what that lady's name was asking about parents. I had an incident recently where the child had gone into foster care and was under the care of the local authority, and we took the proxy access off the parents. Should we not have done that?
No, that's perfect.
All
So
right,
if
okay,
someone
good.
goes into care and then under the care of somebody else,
Right, okay.
you have to make a judgment. You can either turn it all off or you can turn aspects of it off. So especially if it's safeguarding, you shouldn't be showing any of that anyway.
Yeah. Okay, that's what I thought. But I just wanted to check with you saying biological parents. I thought, oh no.
Yeah, I mean, going back to your question, what you said about the LPAs when you do your searches, one thing that will throw up, and GPs are very good at doing this, they'll go and do, say, end of life, or they'll do an assessment on a patient, and the patient will tell the doctor that they've got an LPA, and then the doctor just codes it.
Yeah. To be honest, I've had 2 instances in the last year where it's been the same thing. Like I say, that same document where it's not the final document and it's from a previous surgery. They've not submitted it to our surgery. So then I'm having to do, obviously then chase up the family to say, can we have the actual document?
Yeah.
But yeah, it's fine. I'll figure it out to the practice, and obviously we need to put some work on that.
Yes. Okay.
Thank you.
No, thank you. Vera?
Hi, my question was with regards to parental rights. With fathers, we would always ask for the birth certificate to make sure that dad was actually named on the birth certificate if we were going to give any information.
Yeah, and that comes back to your ID. So when we go into this a bit later on in the process and the IDs, that is part of it, that if you would have a child under the age of 11, then you would ask for the ID of the father. So like you said, the birth certificate. Is that okay?
Yeah, that's fine, thanks. Yeah.
So the advanced care planning by GP. I'm not sure if any of your GP practices and your GPs do this, because I know a lot of practices don't. We've recently taken on a care home and we're doing a lot of advanced care planning, and there's 32 residents in the care home, and we're just currently going through everyone just to make sure there is LPAs or proxy needs putting in place. So the best thing to do is, if the doctor is doing an advanced planning, that they have a structure in place. So if there is an LPA, that the GP, as I mentioned, doesn't just record that their LPA is there, that they get making sure that they're bringing a copy in for us, and then we're getting that code from them so we can double check it's in place. We have to remember that when we are doing the advanced care plan, or the GPs are, it is individual, and it has to be focused on the patient's values. When I can say values, it's what they want. So you could have a patient that is going through an advanced care planning and they're telling you or the doctor that they don't want a certain individual ever to have access. It is really important that this is recorded. Again, going back to scenario here, we had a lady that we knew she had dementia, but it wasn't diagnosed. So at that point, they're deemed to have capacity, and it was fluctuating. So you have to say that she had capacity at the time. She said at that time she did not want her son ever to have access to her notes if she ever lost capacity. And in time passed, she lost her capacity. She was diagnosed with dementia, and her son came forward asking for access. And it was clear on her notes that he wasn't to be given any access, so it was declined. Wasn't a very nice situation at the time to deal with, but his mum had already put that in place. So it's really important to make sure when any conversations had with the patient in regards to advanced care planning, that it's very well documented and easy to find. So those practices that get the patients to come in and do the proxy access forms, we all know that there is always a risk of coercion, no matter how much you believe that's not going on. Sometimes it is. So what is coercion? So the meaning is it's pressure, manipulating or intimidating someone to give proxy access or assigning decision-making power. It does apply to LPAs as well, but we're going to concentrate on the proxy access. I mean, you might see things like emotional pressure. Oh, if you love me, you'd let me handle everything. And I've seen that over the 20 odd years I've been a practice manager. They could threaten to withhold the care or support. And they could exploit confusion, illnesses or cognitive decline. And again, I've seen all this happen. In regards, just going back to the coercion, just to give you an example, I've had a member of my staff go out into the waiting room, sit with the patient and the proxy, gone for everything, and then come to me at the end of it and when I'm not happy about this. I think the patient's being coerced. Give me all the information. I then looked into the records and it's kind of been an alert because the patient has been on a lot of controlled drugs. And when you read the history, or when I read the history, there's been a lot of access by the daughter trying to order medication, and it looked like there was a conversation to say that proxy was needed. I then had a conversation with the patient just to say that I wasn't happy. I felt that she was being coerced, and she actually opened up to me on the phone saying, yeah, her daughter's very manipulating. She wants to take everything from her. She's taken a controlled drug. And that just opened a whole other problem for us. So you have got to be really careful. Whoever's sitting with them, when they're filling the form in, they have to have an awareness of what's going on. So just remember that the patients may be put under pressure to give consent against the wishes. And any safeguarding signs they need to look out for and report it back straight away. If you feel that they are being coerced, you can refuse the access until you establish a true position with the patient. Or if you still suspect it, that they're being coerced, then just decline it, or you can limit it. So you don't have to give full access. It could be that the patient's granted full access, but you're just going to grant prescriptions or appointments or just one or the other. So you can limit it. Or if you are going to give access to the whole of records, again, you can limit what you can give in EMIS, but we'll come on to that. So declining access. I think a lot of patients think that it's a given right that they can have access to the records. It's not. The records that are on your system belong to the practice, not the patient. The NHS Act came about mainly about 2.5, 3 years ago, and over the years it's just got more and more patients and more aware that they can have access, and it just goes back to thinking that they can have access to everything. So what grounds can you decline or withdraw? So practice staff have a good ground for suspicion that the patient consenting to the proxy access is not doing so willingly. The patient does not understand what is being explained to them and has no clue of what they are consenting to. And that goes back to the example I've just given you, that the patient has ticked everything, thinks that they're being coerced. Sorry, the member of staff thinks they're being coerced, and then when you have a conversation with them, everything comes out. There's also been examples where the proxy has been explained and the patient clearly doesn't understand what's going on. Again, on that grounds, if they don't know what they're consenting to, you need to think about, is it safe to give them access? Authorised practice staff believe that a patient under 16 is competent to make their own decision on their access and does not give consent for proxy access by the person who's seeking it. Mentioned before, an example, you've got a 14-year-old that is now deemed competent. Parents still want to have access, but at that point, because they're deemed competent, you can withdraw access for the proxy. The suspicion that the proxy will create a risk to the security and privacy of the patient. And again, I have seen this over the years where they've been a proxy, they've had access to everything, and they've actually used information in the patient records against the patient, which you just think is unbelievable, but it happens. The patient, having previously expressed the wish not to grant proxy access to a specific individual, loses capacity, which I've previously mentioned, and that can be permanent or on a temporary basis. So when we say someone loses capacity, we've also got to remember that it might not be permanent. someone might have had a stroke and at that point they've lost capacity, but they might regain it later on. And the patient's GP assesses that the proxy access being requested is not in the best interest of the patient. So it might not be the GP, it might be yourself as practice manager or whoever in your practice just thinks, no, I am not happy to grant this. What I tend to do in them situations is have a conversation with the GP partners, express my concerns to them. They might know that patient better than I do, or it might be someone in the practice that knows that patient better than anyone else, and just have that team conversation to say, do you actually think it's in the best interest of the patient or not? Any questions before I move on? Oh, hi. So, reviewing of the access, this is where the work comes in. And I think a lot of practices that I've spoken to previously think this is like the main workload that they get when they get the proxy in, because they have to review everything in their notes to make sure, can they have access? Is there anything in there that shouldn't be in there? Should I give it? Should I not give it? And there's a lot of work to it, especially with them patients that have been with the practice forever and the notes are huge. There's a lot of work involved. So also when you're reviewing it, it's not just reviewing when they ask for proxy. You need to be checking it when the patient may lose capacity. And is there something in the records to say that once they've lost capacity, they no longer want this person to have access to the notes? Doesn't happen very often, but it could. Unless the patient has specifically consented before they lost capacity, then that can continue. If they haven't, then you would have to go through the LPA route. Once a patient has lost the capacity and an LPA isn't in place, then it would have to go through the courts. There's a whole host of problems related to that. Where the proxy access has been enabled on behalf of an adult patient who lacks capacity, it should be reviewed if there's a change. So again, going back to, have they now got the capacity back? If that is the case, if the patient lacked capacity and now has capacity, the proxy access should only continue with the patient's consent, because they now have the capacity to give you that consent, if that makes sense. There's all losing it, getting it back, and then having it and losing it. So it can go both ways. So proxy access without the patient's consent, there are circumstances where the practice may authorise proxy access without the patient consent. So we've already spoken about an LPA being in place, and it being registered with the Office of Public Guardian. There's a court-appointed deputy on behalf of the patient. The patient has been assessed as lacking capacity to make a decision on granting proxy access, and in accordance with the Mental Capacity Act 2005, the GP considers it in the best interest to grant the request access to the applicant. Again, this doesn't happen very often, but it can happen. I've dealt with it probably 3 or 4 times in the last 4 years or so. So it doesn't happen very often. It's just, you need to know what you're talking about before you go ahead and speak to the patient. And it's going back to making sure the LPAs are in place, it's the right LPA, the patient lacks capacity. And if you're unsure, then it's not great if you're talking to the patient that it doesn't instill confidence in them. The patient has been assessed as lacking capacity to make a decision on granting proxy access, but there is a record of the patient having made an advanced decision about the individual seeking proxy. So at that point, it's already been granted before, it's in the notes, therefore you can grant it. And as we've already said before, the patient is a child before their 11th birthday and is not competent at granting proxy access. If the applicant is a health professional who has a legitimate relationship with the patient for providing direct care, so for example, a nurse working in a nursing home, they can apply to have access. However, I think this is a really tricky area for staff because, as you know, the staff in the care homes come and go. So how do you know that they're still working there? Do you do regular check-ins? I would look at the benefits and the risks. Which do the benefits outweigh the risk? It's something I would say avoid. However, you could consider just switching on, say, prescription ordering and not give them access to anything else. If you do switch it on for someone in a nursing home, I would make a document of it and make sure that this is being regularly checked, that that person is still there. Any questions before we move on? Because I know it can get really complicated with the patient consent. Nope. Okay. So we've already looked at the questions at the beginning about what your processes are, and everyone's is slightly different. But the process is to verify the ID of the patient giving consent. And you also need the proxy access ID as well. So, or the third party, whoever is seeking the access to it. So the ID can be passport, driving license. They're the main things that we will look at. Utility bills. It's best to get a picture ID, so it could be a bus pass, but then have that with something else to make sure that you know that legitimately living at that address. Also, if it's a child, you can ask for the birth certificate, especially as mentioned before, that the father is named on the birth certificate that is asking for access. You then need to confirm that the patient is given informed consent to it. So that means that they fill the form in and they're informed about what the proxy access is. So, what is the legal justification for giving this? If they are lacking capacity and the proxy is requesting it and they have an LPA, that is a legal justification for it because they're named on the health and welfare LPA. Always establish the level of access that the patient wants the proxy to have. So again, going through the prescriptions, the appointments, access to medical records, speaking, acting on behalf of the patient. You need to seek assurance that the patient is not being coerced to agree to the proxy access unwillingly, and consider withholding proxy until any suspicions are investigated and the outcome is known. Obtain a completed proxy access form from the patient and proxy, and I will be sending out a template at the end of the training so you can all have a copy of this. You don't have to use that one, you can adapt it to your own for your practice. It is really vital that the patient and the proxy complete the form at the practice with a member of staff talking through the process. This will stop any coercion and confusion to what the proxy access is. So this is like my main thing that I go to. It is so vital that it's done within your practice. Your staff are trained, or whoever you want them to do this, that they know the ins and outs of this, because you can have scenarios which I hold my hand up, we used to do this. They'll take the form, go home, and then come back with their ID. And we never got to see who the actual proxy was. It was just the patient, and it never sat right with me. this is why we do it this way. We need to know who they are. We have the pictures on file then. You have, when they fill the form in, they fill absolutely everything, the name, their address, date of birth, what relationship they are to the patient. So we know from the start who they are. So once you've got the form and it's completed, you need to make sure that the staff who are with them put their information on that form. There is an area on the form which I'll show you soon where the staff just put their initials and the date. Then they need to obtain authorization from either the practice manager or a senior person or clinician to have the access to the records. This will be based on your individual processes. I can't tell you who should be doing that in your practice. That's entirely up to you. But all I would say is make sure it is someone of a senior level. Going back to, did the proxy and the patient understand what the information was that they were given? And ensure that the proxy understands how to maintain the privacy and security of the patient records and how and when to discuss with the practice anything in the record that worries them. And that just goes back to discussing that when they're completing the form. All this information is on a patient leaflet that I will share as well. It just goes into a lot of detail so they can make an informed decision. So once all that's come through, and if it's yourself that's doing that, that will come to you. You then need to do an enhanced review on the notes. So it is possible to redact all or any harmful information from the Proxy Access. We all have the online, offline button in EMIS where you can switch on and off. There's also information within the Access, so you're setting up your proxy where you can switch certain bits off. When you're informing the patient about the Proxy Access, ensure that they understand that they have a choice. So it just goes back, and I know I keep reiterating the same thing, but it's just making sure that they know they have a choice that they're given. And always remember that you can reduce or remove the proxy access if you feel it will be in the patient's best interest. So as I mentioned, this is the consent form. It's very small on here, but A4, 2 sides, and it asks for the patient's details, it asks what access that they would like. So it's asking for consent, it asks for the patient and the proxy to sign. And then on the other side, there is information that the proxy will fill in. So add the name, their address, what relationship they are to the patient, date of birth, telephone number, email address. All this is really important because otherwise you can't set them up on the system. When the form is completed, it's really important that it's checked that it's completed properly, otherwise they would have to come back in. And in this section here, for the practice staff use only, there is a box for the date, the NHS number of the patient, and the initials or name of the member of staff who sat with them while they were filling the form in. I find this really important because if I have any questions, I can then go back to that individual and ask them, you know, was there any suspicion? What happened? Did they understand? Just have that conversation with them before I go ahead with filling the form, with giving access to the patient and the proxy. There's also an information leaflet. It's 4 sides, all A4, and it goes into what proxy access is, how to make an informed decision, that they don't have to do this. It's a lot of information on there for the patient. I recommend that if you're going to be doing a little bit of background work before you start doing this in your practice and you're doing your searches, that these are sent out to the patient and, well, before they come in, just to give them the heads up that this may be happening. in the next couple of weeks. Here's some information for you to read. If you want to continue with proxy, because you might have informal proxy at the moment, then have a read of it, and then you can make an appointment for it to come in at some point. So online access within EMIS. So I'm sure most of you know how to do this, but there is a lot of confusion that I find about where you go to do the proxy. The proxy is always done in the patient's records, not the other way around. So you could have a husband and wife that want proxy for each other. You wouldn't go into the husband's to give proxy access because you're basically giving it for themselves. It has to be the patient that's giving consent for the proxy. So within your EMIS system, you go into your registrations. You then click on your online services. You would add a user. And then here you've got add proxy user. So once you've seen that, you then enter the full name and the gender of the person that you're trying to find on the system. This box will appear, and then you click on find. If they're registered at your practice and already have online access, then that will appear. If they're not registered at your practice, you can still create an account. So it will give you a new box, which is here, and you just click on create new account and a new box would come up. That is why it's really important to get all the information when they're filling the form in, because otherwise you can't give access to anyone. Really important as well that you get their email address so it's stored on the system. You can send the PIN number out to them. Once you've entered all this information, then you can then decide what access you're going to give to the proxy. And the decisions will be everything, or you can just click on prescriptions, or you can just click on individual items. So you say, for instance, you were going to give access to everything, and you wanted the records to go back to the beginning because that's when the patient wanted them. So you'd put the 1st of the 1st, 1900, because that's the default date that we have to put in. Once you've done all that, you then untick, and this is really important, you untick the text boxes. So in your EMIS system, you'll have your labs, you'd have your consultations, you have your problems, and under each one of them, it'll say show text. Please untick the text, because otherwise, when you're typing in EMIS, they will see everything if you're giving them access. That has happened at my practice quite a lot of times when someone's done this previously, and it's caused a lot of problems, especially when you're writing things in the notes that you think, yeah, the patient doesn't need to read that. If you don't untick it, be mindful that when you're putting things into the EMIS consultations or anywhere in the notes, anything in text will be seen unless you hide it. So you can switch it to offline. So just be really, really mindful. So in summary, proxy access is a serious matter and should be considered on a case-by-case basis. The individual giving consent must have the capacity to do so if they're an adult. Wherever possible, consent should be given in person with the proxy present alongside the patient. All relevant forms must be completed and appropriate ID checks carried out. Does anyone have any examples that they can share or any questions that they have? Rachel?
So it was just a question that came up in one of the NHS app ambassador groups that I'm in. And it was in relation to sometimes we have spouses where they're asking for proxy access, but they share the same email address. Does that cause an issue, or do they need to have different address? I thought that was the case.
Yeah. So if you have someone, and it's still happening in my practice, that you will have patients with the same email address, they have to be individual. And it's really important as well that when you are checking patients' notes, so if they're phoning up for an appointment, I always ask my staff just to double check their email address. does it actually say the name, or is it related to someone else? Because again, if there is an email address on there, and you can see in the emails corner where it says PDS, and then you've got your OS and your proxy. So if your online is in green, but then it's an email address of someone else, that means that someone else is accessing their records, which is not great. So always check it. It should be in the EMIS corner that you have your OS is in green if the patient has it with the patient email address. And then if someone has proxy access, then the proxy access next to it is highlighted in orange. Is that okay? Susan?
Yeah, so Claire, I'm a GP. So when we've been sort of trying to set up our process for a couple of years, and when we get requests for proxy access, we pretty much will only give it from the date of the request, in the knowledge that so far we've been getting away with that.
Yeah.
So I know there are other practices who their default is almost to do that 1/1/1900, but then obviously you've got all the additional work in terms of redacting all of the records. So we've generally just done it from the date of request. That then means that everything going forward, the whole practice know how to redact everything, so it's sort of safe. So it was really, I suppose, just to ask when your practice decided that actually you would sort of, it sounds like you err on the side of if they want full access, you just give them everything, whereas we sort of keep quiet in the hope that they don't want it. The other thing that I just wanted to ask you, sorry, 2 questions, is can you go over the bit? So Denise, our receptionist who grants the proxy access, she's actually on your next training session, but just so that I understand it, can you just repeat the bit about unticking show text?
Yes.
Be it that Denise will probably understand that and she can show me when she's done it.
Yeah, so when you go into the granting proxy access, and it's the same for the patients as well. When you go into the main body of it, once you've put the name, the founder, it will have a list at the top and it'll say demographics, prescriptions, mine's gone blank, medical records, and there's another one which I can't think where it is. So there's 4 different ones. When you go down a little bit further, when you scroll down, you would tick on access medical records. Once you've ticked on there, that's where you put your date in. Once you put that date in, it automatically defaults to everything. So that's your text, your labs. From that bit, you can then customize it. So you then customize, and then you can then individually take out whatever you don't want the patient to see. And you can also change the dates. So say, for instance, you're happy for them to have everything from the 1st to the 1st, 1900, but you don't want them to see the letters from then. You can go into the individual customization and change the date and untick. So you can customize it so it doesn't have to be a default on there.
Okay.
It does make more sense when you look at it.
Yeah, no problem. And then just another really small point is, so we have the forms, and again, anybody who wants full access to the record. So if, for example, it's appointments, prescriptions, then our reception member staff will do that. But if they want full access, then it comes to me. But again, loads of times when I actually then speak to the member, they don't want full access. And I just wondered if any practice, because again, with the forms, it's just sort of, I think they just tick appointments, prescriptions, full access. Maybe it's just how it's just explained to them in the first place by the member staff, getting them to fill in the form.
Yeah. So it does
I might
make
have answered my own question.
No, so it does make a huge difference when a member of staff sits with them and explains. So I was like you, oh, thank you, Rachel. Rachel's done a screenshot for us. It does make a huge difference because when they actually have that conversation and explain very clearly, they then go, oh, and it's a realization that they don't want everyone to have access to the records. They only want prescriptions and appointments, for instance. We had it before where everyone was ticked like yours is, and it just caused me so much work.
Yeah, me
Whereas
too.
now we've done all the training for everybody and everyone knows what they're saying to the patient, and it has reduced my workload.
That's brilliant. Thank you.
And then going back to your first question about when my practice decided to do the first 1900, it was October 2023. We did this, and it was way before everyone else. But what we did before, we did a lot of work on the enhanced codes. So there is a search within your EMI system that looks at anyone that has an abuse relationship, anything to do with mental health, any safeguarding. There's a whole host of things that it will look at. Anyone that's in them searches should be batch coded as needing an enhanced review before access is given. So we did all that work before we actually went live with the first.
Yeah, so we did that too, but that was for their access to their own records.
Yeah, but it does make a huge difference when you're doing the proxy.
So you then look for that enhanced code again?
Yeah.
Got you.
Yeah.
Okay.
Yeah. So Angela said that you only give access from the date they request the access, which I think a lot of practices still are doing, but NHS England from October 2024, if I remember rightly, the date, it does say that we should be granting access to the whole records from the first 1900. But I know there was a lot of pushback on it. Some practice went live with it, some didn't. I think it just depends how you feel about your own individual practice records. Any other questions? Or has anyone got any examples that they want to share that so they've come across in a practice and they don't know? Natalie?
Hello. So I'm quite new into the practice, and just then while I was just talking, I just ran a quick search in EMIS because, as far as I'm aware, we've not fully started the proxy access process. And I've come across 8 children, 11 and above, that apparently got proxy or
Right.
that have a proxy attached to them. I know for a fact that we've not like switched it off or interviewed them or anything along those lines, because these must be historic things or historic ones that have been actioned. So what would you suggest the best course of action now for these ones that I know are over 11?
So I wouldn't panic, that's the first thing, because there are lots of practices out there in the same position. Start doing a piece of work where you can have a letter ready to send out to the parents of these children, just explaining that you're looking at your processes and it's something that you will be actioning in the coming months or whatever time period that you want. I would also look at them 8 children just to make sure what proxy access the parents have actually got. Have they got access to everything? And at the moment, do you feel like there's anything in the notes that you think scream out to you think I need to turn that off? So they're the first things that I would do. And then once you're up to speed and you think, right, we're happy to start this, then contact the parents again and say they need to come in and go through the proxy process and explain to them what it is, why you're doing it. A lot of parents do push back, especially when they're 11 years old, saying, my child's only 11. Why do you need to have this conversation? I'm their parent. So you will get that, but if you educate the parents about why, then they kind of understand it. And I've not had any pushback for a long time because I've been doing this for quite a while.
Yeah, that's really helpful. Thank you. The second half, honestly, is going to be a little bit tough because I have an 11-year-old and the GP's not had that conversation with me, and I'd be saying the exact same thing.
Yeah.
You know, she's 11, she doesn't cross the road by herself, never mind go to the GP by herself. But I understand that them are the rules, and yeah, that's what we need to do. But it's hard seeing both sides in the fact that, yeah, I have an 11-year-old, and I probably agree with what the parents are saying if they push back on it. But
yeah, it's just going back to having that conversation with them. And is the 11-year-old like mature enough to make that decision? I think from my personal point of view, and it is my personal point of view, an 11-year-old probably isn't competent enough to make that decision. But over the years, I've had 12, 13-year-olds that have come in, not wanted their parents to know because of things that are going on in their life. So you can see it from that point of view as well.
Okay. Yeah.
But
All
it
right.
is having a conversation with the parents.
Okay. Thanks.
Rachel?
I just thought it was worth mentioning, if the person who's requesting the proxy isn't registered at the same GP as the patient, they can't access it on the NHS app. They can only do it via patient access.
No, they can. I think this has come up before where they said they haven't. So we've tested it here and it does. So what happens is you go into the app and you've got to mess with it for quite a bit for it to come up. But eventually you will have access to both. So you can see them. So I've tested it with the permission of my husband. And I could see both of them on my NHS app.
And you're not registered at the same practice now?
No.
See, every patient I've tried to do where they're not registered at the same practice, they can't see it on the NHS app. And when I Googled it, it took me to an NHS app page where it stated that they couldn't. And every NHS app webinar I've been on, they've said it's not a functionality at the minute.
Well, it's working on my phone. It's something that I'll double check on that, Rachel. I'll get back to you all on it. But as far as I'm concerned, that was the whole point of having someone being on a proxy registered somewhere else, so you can have everything on your phone instead of going into patient access.
Well, when I looked into it, it was only on patient access that they could see the proxy if they were registered at another GP surgery. But yeah, if you wouldn't mind, and then
yeah, of course I will. I'll take that back and let you all know.
Thank you.
I'm conscious of time. It's coming up to 3:20, so we've got another 10 minutes. If anyone's got any other questions or queries or anything that they want me to go over again, more than happy to do so before we end the session. Sue?
Sorry, me again. I just wanted to ask you if you have ever, again, I've read that children, I think above 13, but under 16, can have access to their own records. But I've sort of, again, head down, hope nobody would ask, and I've no idea how you do it. Has anyone been able to do it or been asked for it?
Yeah, so we get asked this all the time. So it's only a GP that can authorise the access to the 11 to 15-year-old to have access individually. And that usually means the child comes in, they have a conversation with the GP, and then they say, yeah, you can have your own access. Plus, the parents still have proxy access as well. There is a code which I will share with you just after the training's finished that you have to put in to the records, and that will enable you then to give them access.
Brilliant, thank you.
Anything else? No. Well, thank you very much for attending. It's been a really good, hopefully useful afternoon for you, and that you're taking a lot of information back with you. I'm going to pop my email address in the chat as well. So if you have any questions following the training, don't be afraid to get in touch with me. I will answer your queries or questions. We'll also be sharing the slides. The recording will be on the Teams link, and I'll share the patient information with you as well. I've just got a question here. Really patient advice on what to say with conversations with parents when you're having a conversation about 11-year-old. It can be tricky, but the best thing to do is put everything in a letter. I can share letters that we have here at the practice, and it just outlines everything. And I always find it's easier than having a conversation, because sometimes you have a conversation with parents, they can kind of misconstrue what you're saying and take it in a different way. Whereas if it's in writing, it's there for them to read. They kind of take it on a little bit more. So that's the advice I would give. Yeah, I'm more than happy to share anything that you need. And again, I will put my email address in the chat, so please feel free to get in touch. Okay, if there's no more questions, I'll let you all go. And thank you. Okay.